An estimated 1 million cases of herpes zoster occur annually in the United States. The incidence for herpes zoster is approximately 4 cases per 1,000 U.S. population. Meanwhile, the incidence among people over 60 years is about 1 case per 100 U.S. population annually. What is herpes zoster? Herpes zoster, or commonly known as shingles, is the reactivation of the varicella zoster virus. The same virus causes chickenpox. Almost 1 out of 3 people in the United States will develop shingles in their lifetime. Did you know that if you had chickenpox before, you are at increased risk of shingles? Before we go in deeper about shingles, let's see few comments from previous shingles patients. So how does shingles happen? The varicella zoster virus is transported through sensory axons to the dorsal root ganglia, which contain cell bodies for sensory nerves that carry information throughout the human spinal cord and causing latent infection in the neuron. How can shingles be transmitted? Take note that shingles is not contagious. A person with active shingles can spread the virus through direct contact with fluid from rash blisters. The rash blisters are considered non-infectious only after crusting or drying. Shingles can also be transmitted via airborne from individuals with localized herpes zoster. But what are the risk factors? Most people have only single episode of shingles in their lifetime. However, multiple episodes are also possible. People with following conditions that can lower their immune systems, such as cancer, HIV, and taking immunosuppressive medications. What are the signs and symptoms? Painful and itching rashes is the most common symptoms. Other symptoms include fever, chills, and upset stomach. Are there any complications? Of course. The most common is known as post-herpetic neuralgia, or PHN. PHN is a pain that stays in the area where the rash once was for more than 90 days after rash onset. Other complications include brain inflammation, blindness, hearing problem, and death. So how do we diagnose shingles? It is usually easy to make an accurate clinical diagnosis if the rash has appeared. If the rash is absent, it might not be possible to diagnose. Polymerase chain reaction is the most useful test to diagnose it without rash. Let's move on to the treatment. Sad to say, there are no cure for shingles, but antiviral medicine can help. One of it is acyclovir. For pain relief, use paracetamol. Zostavax is the best protection against shingles. It can be given to adults over 50 and only 1 dose is required. The vaccine not only decreases the chances of getting shingles, it also reduces the probability of having future breakout. Good news is that the shingles vaccines are available at local community pharmacy. How do we prevent spreading of shingles? Cover rashes. Avoid scratching and touching rashes. And wash hands often. Remember, shingles hurt, and you might not want to put yourself into unnecessary risk. Do consult your physicians for additional questions.